be keeping good hair? Hello everyone, good evening everybody. I am Sani Acharya from beautiful Spotless Skin team. I am sure all of you must be keeping good hair. Hair loss, whether it's in hair loss in men or hair loss in women, is a common biological problem all over the world, not just in India. The importance of hair in enhancing the overall personality of a human being cannot be overestimated. Hair loss, on the other hand, can prove to be a real disadvantage for many people. Many young boys and girls start losing their hair early in life, caused by a variety of genetic, environmental, and systematic factors. Hair fall can affect everyone, regardless of their country or region. Thankfully, effective hair treatment can control and even reverse the hair loss process. We are here to know more about hair loss, its management, and more in detail about hair transplant from an expert. So let's connect today with our hair expert, Dr. Deepak Sharma, live from Jaipur to make aware on hair loss and its management. Dr. Deepak Sharma is a young and vibrant consultant dermatologist and trichologist from Jaipur. Dr. Deepak is attached to Jaipuriya Hospital, Jaipur, and has done his master's from R&T Medical College, Udaipur. Today, Dr. Deepak Sharma will share with us on hair loss and hair transplant. So over to you, doctor.
Hello. Am I audible?
Yes, doctor. Yes, sir.
Thank you for inviting me for this online platform. As you said about my post graduation, and right now I'm working as a consultant dermatologist in Jaipuriya Hospital, which is attached to the RUHS Medical College. Quickly shifting to the topic, yes, here is a issue for young people. Like right now in daily OPDs, at least 15 to 20% of people who are young, and especially I want to elaborate this point. The young mean to say not like after 30 or 35. Young mean to say the people are coming in their 20s, like male and the female, young boys, young girls. They have complained of hair loss like in their early 20s, and on the investigations they are perfectly fine. There's no underlying issue. But see, we need to consider this COVID wave. Like past 2 years, we were fighting to this disastrous endemic, and after that, we are facing another endemic, that is hair loss.
Right, absolutely, doctor. Doctor, so why does hair loss occur?
See, we need to understand hair loss. Basically, broadly, they are divided in two categories. For the lemon person, I want to explain it in the way there is a permanent hair loss and there is a non-permanent hair loss. In permanent hair loss, you can understand if a person have some inflammatory pathology on the scalp and the skin, or for example a person with a road traffic accident met with a road traffic accident and he has a scar over the scalp, there will be a permanent hair loss. So we will lose that stem, that mother cell by which a hair come out. So that is a permanent hair loss. We have very less or very few options for the treatment of permanent hair loss. But on the another category, in the non-permanent hair loss, in which the most common is androgenetic alopecia, in which is a male pattern hair loss or female pattern hair loss. Commonly, we know like we tag this condition as a baldness. So that is treatable. Uh, Timely intervention is very important for the hair loss because it's all about the volume. See, we need a very large number of the hairs on the scalp for a good look. It doesn't count well if you have few hair growth and you look bald still after taking so much treatment.
Right, absolutely, doctor. Doctor, when we are talking about hair loss, so who is affected by hair loss and is hair loss preventable?
Yes, definitely it is a preventable. See, we need to thoroughly investigate a person with a hair loss. Uh, in almost 25 to 30% cases, there is always a reason. For example, a young girl who has because in India, in Indian women's there's a lot of cases with the anemia. So if a young woman who's suffering from the anemia means to say the hemoglobin is less, the hemoglobin is less, and she's suffering for a long period, and she had a hair fall. So if we find out that reason, anemia is one of the cause. Other causes can be like vitamin D deficiency, vitamin B12 deficiency, because in India there's a lot of people who are a strict vegetarian. So every time a young person who are coming with a severe or like a history of hair loss for prolonged time, we need to find out, we need to look for a reason first. If all the investigation or the other causes are okay, then we can label it as a female pattern hair loss. So I think it's a kind of tricky question.
Yes, yes, doctor. Doctor, so how much hair loss in a day is considered normal?
See, in literature, what we in literature there is a around 100 to 120 hairs. If they go daily, it's a normal, because if you lost 100, you regain 110. But for the people, for the because you cannot count your hairs in 24 hours, because you can lose hairs during the bath, in the bathroom, on the bed, on the pillow, during the work. If you study, the hairs are continually falling on your book, so you cannot count. It's a broad term, but if you are seeing that shedding of the hairs are continuously, if you are noticing that it is not the routine hair fall which you are experiencing throughout your life, and you are experiencing that the number of hairs increases by double or the triple, so then that is abnormal. This sudden changes is alarming, which you need to understand, and you need to consult with your doctor.
Right, right, doctors. Doctor, when we are talking about hair fall, so many times hair falls out in the shower, and should we wash it less, or how many times in a week? Is that a problem, or is that considered as a cause of hair loss?
Again, washing of a hair is another aspect. See, in today in market, like you have variety of products. Every products have its unique, like unique selling features of that shampoo. Something are for the shining, repair, and all and all and all. So you can't pick each and everything. Like for 7 days, you cannot change your shampoo, but shampooing is again tricky. Some people prefer like 7 days a week shampooing daily. But as far as with my experience, I usually suggest my patient maximum three episodes, 3 times shampooing in a week is more than.
Okay, okay, doctor. So, doctor is explaining us the causes of hair loss, and now we also have live viewers question. So, doctor will be there with us within a few minutes. Welcome, everyone who is watching the live, and we have live viewers question also. So, we'll ask the doctor about that also. We are talking about hair loss and its treatment today, and you are watching Beautiful Spotless Skin. My name is Anya Acharya. So we are going through all the questions. How does hair loss is considered normal? Doctor is answering all the questions.
Yeah.
Hello,
Did I
hello,
miss
doctor.
something?
No, no, no. So now we have the question from our viewers who are seeing this live. So Shubham Maran is here, and he is asking why it is important to use hair conditioner.
Shampooing alone is not sufficient. Conditioner, the answer is in the word. Conditioner is nothing to do with your hair growth or like nourishment of your hairs. Conditioner is all about the good looking healthy hairs. So some people are saying that my hairs are rough, they are oily, they don't look fluffy. I need that Ajay Devgan kind of hairstyle, which like Shahid Kapoor kind of hairstyle. So conditioner is all about the look of hair.
Right, doctor. So does dandruff cause hair loss?
Definitely, definitely. Dandruff cause hair loss because there's a two reason. One, that something is going in the skin. It's kind of reaction of your skin to the to a infection which is caused by a fungus. That is a most accepted hypothesis about the dandruff. Second thing, this dandruff, this seborrheic dermatitis, constantly causes itching on your scalp. So you keep rubbing your scalp with your hand. So you are giving a two kind of trauma to the hairs. First is infection, and another one is a continuous rubbing. So of course, hair fall will increase.
Right. So we have a question from a viewer, Ishita Jha. She's asking, how can I grow more hair?
Okay. Ishita, what is your age? Can I?
Yes, Ishita, doctor is asking your age, and then doctor will be answering this. This is a very nice question, doctor, right? How
Is there
anybody can grow
two-way
hair?
connection? Can I directly connect to that viewer? Is it possible?
Uh, that is not possible, but she must be replying what is her age. Uh,
Okay.
then we have next question from Shruti also.
Maybe. So first I want to finish for that young girl. Yes, you can grow your hairs. See, charity start with the home. So first you need to look for your diet. You need to increase the vitamins, the iron component of your diet, and of course protein, because for the mother cell to grow, they need protein. So you can shift to the paneer, घर का जो पनीर होता है, then sprouts, कोई भी seasonal fruit हुआ. So by the improving this diet, you can see like you will not notice the results immediately, but at the time, like over the time of 2 to 3 months or 4 months, you will notice there's a decent hair growth. Again, next step is by using a simple hair serum. So and every patient is not a candidate for the full flesh treatment. By the simple measures or the simple hair serums, you can promote a good hair growth.
Okay, okay. I hope, Ishita, you got your answer. Doctor, there are more questions coming up. Shruti Nigam is asking, am I losing more hair than I should be? Do we lose more hair in a day when we get older?
Do we need, pardon please, more?
More, she's asking, do we lose more hairs in a day when we get older?
Definitely, definitely. Aging is a process by which your capacity of regeneration is a decrease compared to the capacity of losing. So with the life, as the age is increasing, definitely the rate of building, the rate of forming of new hair is decreased. So definitely you will lose more hair. You can notice around you, like the people, especially the males, after 30 or 35, maximum males lose their front hair line. And in females, of course, the length is more, so it is a less noticeable. But of yes, that is sure. The rate of hair loss is increased.
Okay. So, doctor, we have question from Aman Sharma. He's asking, how do I know if my hair loss is due to male pattern baldness?
See, it is a diagnosis which is made by a qualified dermatologist, trichologist. But in general saying, if you start noticing receding your hairline, that is a first indication of a male pattern hair loss. You notice, because there's a different pattern of hair loss. Some autoimmune conditions which causes hair loss, like within 24 hours you will notice some patches, but they are absolutely complete clear patch. But male pattern hair loss is a progressive. It will not happen like within 7 days or within a month. It is like continuous process, and you will notice some like shallow, some slightly less density area you will notice, and you will see the hairline recede progressively to the back side. That is a few things which you can notice.
Okay, so I hope, Aman, you got your answer. Sir is explaining us very, very, very nicely. Sir, there are more questions coming up from our viewers. Neha Chaudhary is here and she's asking, what is the cause of dandruff and dry scalp?
Dandruff and dry scalp. See, there's a multiple reasons for the seborrheic dermatitis. That is a medical term for the dandruff. But the most acceptable thesis is like it is a fungal infection of the scalp. The people, especially young people who are living in the hostel, like we are terming it as a overcrowding place. So sharing things, and like don't a less hygienic environment around you, don't care of hairs properly, like some people, I'm not offending anyone, but like a hair wash in couple of weeks, these are the things which promote dandruff.
Right. Sir, Aarti Meena is here and she's asking, how can one stop hair fall?
You are asking uh, all thing in single statement, and that is very correct. Yes sir, all the causes, all the thing, sab theek hai, but how can I stop it? Yeah, that is a very like innocent question. See Aarti, you need to take care of your hair thing. You need to visit a dermatologist, and just discuss the thing. See, every different kind of reason have a different solution. You cannot apply everything, a single thing in every pathology. So you need to find out what is the reason of that hair fall. You need to attack on that condition. You will see the results. That is a simple answer from my side.
Wow, that's absolutely great. Dr. Palak Dubey is here, and that's a very interesting question. Can children also face hair loss?
Definitely, yes. Children can face hair loss. As I explained earlier, that some pathologies, some inflammatory or autoimmune process which are running into the skin of the scalp, yes, they can cause hair loss. And in children's, because there is some condition which are specific to the children's. And I'm not saying even male pattern hair loss can be seen in the children's below 12 year of age. And again, dandruff is a very common cause in the children. And in the Indian scenario, yes, we are doing good. Our families, medium class families, they are eating good. But what we are eating, that is important, because every time giving a roti with a full of ghee is not the answer of a good diet. The diet should be balanced. Sometimes our children are not eating what they require, so they are facing malnourishment in their body. And yes, hair fall is a sign of malnourishment. So children should be take care very carefully. The reason of hair fall should be explained, it should be evaluated, and according to that condition we need to give treatment.
Yes, sir. Shruti is here and she's saying, sir, my hair fall is getting very high. I have used many products, but I'm not getting any benefit from it all, and I'm half black.
Shruti, immediately visit to my clinic. That is my answer. You need help.
Right, absolutely. So visiting dermatology is always a good idea. Sir, a question like, can accessories like helmets worsen hair loss?
Uh, See, helmet is a kind of pressure trauma. Sharing helmet can a cause of fungal infection, contaminated infection. Using helmet for the maximum time of the day, yes, it can increase sweating. Sweating will increase the chances of infection. Infection will cause hair fall. So it's not wise to blame exclusively to the helmet, but the wearing type, wearing pattern. If you're wearing a very like small helmet that is
So
like
today
very
we have
small
with
to
us
your
Dr.
scalp,
Deepak Sharma.
definitely.
Yes. Doctor, there is question from Soumya Shukla. Why does hair loss occur?
I explained earlier, there's a multiple reason. We broadly divided this condition into the permanent hair loss and non-permanent hair loss. Permanent hair loss, the reason for the permanent hair loss is many. There is some autoimmune inflammatory pathologies like systemic lupus erythematosus, discoid lupus erythematosus. Some patients who are going for chemotherapy and radiotherapy. Some patients who have some multiple pustular lesions, pus filled lesion on the scalp, the children's with a fungal infection of the scalp like tinea capitis, if it is non-treated and the condition is very severe, then it can cause the permanent hair loss. And on the other side, there's a non-permanent hair loss. In my experience, the most common reason for that is the female pattern hair loss or male pattern hair loss, that is known as an androgenetic alopecia. Other is a nutritional. If you are deficient on the iron, your blood is less. If you have anemia, if you have vitamin D deficiency, if you have hypothyroidism, yes, this is very important. If you have vitamin B12 deficiency, if you have some hormonal condition like PCOD, that is a very common in the young female. And so these are the reason of the non-permanent hair loss, which can be treatable. In permanent condition, you have very less option. You need to go for hair transplant kind of steps in permanent hair loss.
Doctor, when we talk about hair transplant, so who should go for hair transplant?
So yes, this is a good question. Not that every patient is a candidate for the hair transplant. But yes, if you see, this question is done by multiple aspects. First, how dedicated you are for your hairs. For a person, for example, a person from the fashion industry or the acting, or like some industry where the look matter very much, and that dedication is very important for the hair transplant. Which patient is a candidate for the hair transplant? But if a person, there's a class, there's a criteria of the hair fall that is known as a Norwood Hamilton classification. If a person with the stage 4 mean to say if a person have like more than half of the scalp is bald, then and the duration of the baldness is like 1.5 to 3 years, and that person during that time of span use all kind of conservative treatment. So by this 3 4 aspect, you decide that is a candidate of hair transplant. If you are not responding to the conservative treatment, if you are belonging to the industry where the look matters very much, and if you have the permanent hair loss where the conservative treatment works not at all, so then you are a candidate of hair transplant.
Doctor, what are the do's and don'ts after hair transplant surgery?
See, a hair transplant is very safe process if it is done by a certified hair transplant surgeon, like a dermatologist or a plastic surgeon. In market, there are many quacks or the many persons that are doing this process who are not eligible for this process. And see, knowledge is thing which is matters at every step. Uh, if a faulty process, you will see many complications. But the hair transplant done by an experienced person who are eligible, who is certified, you will see less because he is an experience. But by on the larger scale, the complications which can occur if you are not hygienic, if you don't care about the hygiene, you can see the infection, the most commonly seen complication of the hair transplant, swelling over the scalp, and if you have a reaction of the drugs, you can see like. But these are very less. most of the adverse effect of hair transplantation in most cases that are seen if it is done by an unexperienced, unauthorized person. If it is done by an experienced person, you will see it is very safe process.
Doctor, there's a viewer question. His name is Lokesh, and he's asking, how does hair transplantation function?
See, hair transplantation is very simple thing. We are not pricking the hairs from the other body. We are taking these hairs from your own body. So see, I'm just showing this area. This area is a donor side, the back of your scalp and the side of your scalp. Depending on the donor area, we are just pricking the hair follicles from that area, and we are just repositioning on that hairs on the front line with making a good hairline. If a person have a very less amount of hairs on the back, see, we cannot take the hairs from here and make this area like bald. So we need to take care of this and the front part simultaneously. So if you have the good donor area, we are taking the hairs from the back. If you have the good hairs on the chest, on the legs, even on the beard, so we can also take the hairs from this side also.
Right, doctor. Doctor, so how long is a recovery from hair transplant surgery?
See, recovery is not so long. It's not a kind of a major surgery, but yes, again, this is a time-taking process which take almost 5 to 6 hours. It's a team management, and after the hair transplant, you need to be. I'm saying like this: very careful, a careful, and a normal. You need to be very careful for next 5 to 7 days. You need to be careful for next 3 weeks, and like you can living a normal life after 17 to 18 days. But you can join your work immediately next day. You don't need to be wait for like couple of days. You can join your work immediately next. Uh,
Dr. Priya Sharma is here and she's asking, what are the risks and complications associated with hair transplant procedure?
See, if we are concerned about the risk, we need to find out, we need to go for some blood investigation. There should not be a history of diabetes, uncontrolled sugar is a contraindicated of the surgery. Your hemoglobin, your blood count should be normal. Your platelet should be normal. You should have a decent donor area. You should not have any disorder related to coagulation, mean to say any disorder which cause more bleeding. And these are the basically these are the uh, major reasons which we consider as a contraindicated or the risk for the hair transplant. And again, as I explained, the complication is an infection, a faulty process, non-judicial use of the drugs which are used in during the operation, uh, don't care of your hygiene, avoiding the proper washing of your hairs is the reason which create a complications after the hair transplant.
Okay. Dr. Palak Dubey is here and she's asking, my hair falls out in the shower. Should I wash it less?
Sorry, pardon, please.
She's asking, my hair falls out in the shower. Should I wash it less?
Again, maybe you're washing more frequently. Maybe you're washing like 5 or 6 times a week. As I said earlier, 3 times. Usually, I advise to my patient 2 to 3 times washing hair is more than enough. 3 times is sufficient. Don't wash them daily.
So daily washing is can be a cause of hair loss, right, doctor? So, doctor, many people. Yes, please, doctor.
Daily washing is again you are giving trauma to your hair or to your hairs. That is a simple answer.
Okay, doctor. Many people use home remedies. So, do home remedies work?
See, what I studied till now, like after 20 years of spending my time in the medical sciences, for using a treatment, you should have a thesis. You should have a study behind it. Fever can be controlled with like cold or ice sponging or the scalp. But why we need to take paracetamol every time? The answer of the question is here. So you can try home remedies, but there's a no study behind it. There's a no proof behind it. You can use, it's your right and it's the availability, but we should use the thing which have a base, which have a study, which have a mechanism of action. So it's not like you can use pyaj ka oil every time.
Right. So every time using home remedies is not an option, right, doctor?
Definitely not. Because in more than 50% of cases, you will see some complication of home remedies.
Right, doctor. Doctor, so can a diet change be the cause of hair loss?
Definitely, the females, the young female, even the male, who are like suffering from the overweight, uh, the people are doing dieting, unauthorized or the untimed dieting again cause malnutrition to you. They will cause hair fall. One may ask, doctor, I changed my diet schedule like 2 or 3 months back, but I'm noticing the hair fall right now. But right now, I'm taking good amount of diet. My answer is that you did it in the past. You hurt your hair here that day. This is the result which are facing today. So definitely malnourishment, not a proper diet, is a reason of hair fall. Like in the metro cities, a continuous undisciplined work environment, workforce, work pressure is a major reason. Behind it is a diet because you are not taking your food all the time. You are not taking the proper food.
Right. So, doctor, what are the fruits or vitamins you suggest to the people, for good hair?
Any seasonal fruit. My answer is any seasonal fruit.
Okay. So,
Just
any
have it.
seasonal, just have fruits. Like more and more fruits will lessen the hair
You
loss.
don't need to buy expensive fruits for your hairs. You can eat simple fruit. That is more than sufficient.
Oh, that is great. So, doctor, we have talked about the hair transplant surgery. So, is there any age where people can go for hair transplant surgery?
So I'm not explaining this as a age, but you should have donor age. It's not the age. Hair transplant can be possible like at 18, at 20, at 30, at 40, even at 50, at 55. But you should have the donor age. That is the first requirement.
Okay. So, doctor, any take-home message to our viewer for the healthy hair?
Okay, my message for the hair: eat good, smile more, sleep well.
That's the I think that's the simple and very good answer for some people and everybody. Like eat healthy, sleep. Doctor, one more question: is sleep is also a factor of hair loss?
See, if you don't sleep on that time, like your time of sleep, according to the biological clock of the body, is 10 p.m. or 11 p.m. maximum. If you are sleeping at 2 o'clock in the morning or 3 o'clock at the morning, you will eat more. The carb craving will be more. You will eat like anything. Definitely, you will not eat a fruit. You will eat Maggie and whatever. I'm not sorry. There's no conflict of interest, but you will eat anything junk. Junk is not good for body. So that is the explanation for my sleep timing for the people.
Doctor, any message for the people who are having hair loss?
As I said, eat good, eat healthy, sleep on time, and smile more. And see if you have hair fall, visit your dermatologist, visit your trichologist. Immediately, don't visit to quacks. Don't believe on the information which is available on the social media. Yes, one may have the benefit with the anything, but it's not necessarily that thing is made for you. You may see some complications, some harmful event with that thing.
Right. Thank you. Thank you so much, Dr. Thank you so much, Dr. Deepak Sharma, for your valuable time. It has been very informative session for our viewers, and it is great to hear you. We really look forward for many such sessions for our viewers in coming time. And thank you, viewers, for all your participation for today's session. Thank you so much.
Thank you. Thank you. Good evening.